everyone. I am going in for my pre-op stuff this morning, but I gotta sit in my massage chair first, get my back loose enough so I can walk. If y'all don't have one of these massage chairs, you need to get one, because this has been a lifesaver for me. I end up sitting in it almost every morning and several times during the day too. Anyway, it's got several settings. I actually made a custom setting that I could make it do what I want it to do. But the spinal care setting is the best one to loosen me up in the mornings. Okay, so you know how when you have surgery, you always have to get all those pre-op tests done? Well, today is my day. I need to go get some blood work done, a chest x-ray, a MRSA test, and an EKG to see if I'm all good for my scoliosis correction surgery next month. So I had to find a new primary care physician because my old one has changed offices and I have no idea where she went. So this is a new appointment with a new doctor and I'm on my way right now. Here I am on the way to the doctor. Since moving here to Lubbock, I am always in awe when I have to go somewhere during what should be called rush hour traffic. It is 8 o'clock in the morning, and there is like no traffic in this town, ever. It amazes me. We used to live in Austin, and it would literally take you 20 minutes to go from our apartment to Walmart, and it was like a half a mile away. It was just awful. I grew up here in Lubbock, and well, just outside of it. And I remember when I was a kid, of course, I never really noticed the traffic or lack thereof. And every time we came home to visit my family, I was always shocked at how little traffic there was here. After, we were truck drivers, so we were all over the country. And then, living in Austin, we lived in the Dallas-Fort Worth area for a while. Then we moved to Austin and absolutely hated it back in Austin. Traffic just sucks there. So we moved back to the Lubbock area when my stepfather passed away. The plan was to move back here and help out my mom a little bit more, or at least be here for her. And I'm getting to where I really regret doing that, honestly. It just seems like every day something silly that, her caregiver should be able to do or whatever, and she calls me to do it. Not that don't get me wrong, I love my mother and I would do just about anything for her. But she just does not get through her head how hard it is for me to get around. She lives in a 3-story senior living apartment type complex, and all they provide for her is the meals. 3 meals a day. She only eats 2, but they provide the meals, and they come clean her apartment, and they do her laundry. And that's pretty much all that they do for her. So now she's gotten to the point that she has hired caregivers. So she has a girl that comes in during the day, and then my youngest daughter works for her at night, and then there's another lady that comes in for the early morning hours to kind of between the two, and she's alone for a couple of hours in the afternoon or whatever. We had to start doing that because she had fallen a few times at night, and they won't help her up there even if if she does call them or hit the emergency button or whatever, all they'll do is come see, what her condition is, and basically find or call an ambulance, or usually it's the fire department that shows up first, and they'll come and help her get up. Well, she hates that because it's so embarrassing for her to have somebody come and help her. And of course, 9 times out of 10, it's at night, so she's in her nightgown, which of course is embarrassing for anybody, but especially for an older woman. So I don't know, I just feel bad for her. We built a little apartment onto our house for her to move in and stay with us, and we spent a lot of money building that little apartment for her, and she ended up living with us for like 9 months, and then she wanted to go back over there. Her reasoning for going back over there was she wanted to be around people her own age. Okay, that's fine, I get it. But then she very rarely leaves her apartment. I mean, I'm talking she'll leave to go to down to eat, and that's about it. And the caregiver that she has during the day gets her out and moving a little more than she would do on her own, for sure. They go and go to Walmart, once a week, whenever the van is taking her to Walmart, and she walks around there, and then she does go for walks 2 or 3 a day, which is good. It's just, I don't know. I don't understand why she wanted to move back over there when she's not really doing anything with the, quote, people her age, but whatever. But anyway, we moved back here. It is cheap to live here, which is one huge benefit. And basically, I don't know how to get fields construction. Okay, I'll probably have to turn. Basically, the only thing, the best thing about moving back here was how cheap it is to live here. I mean, we're talking, the house that we bought is, when we bought the home, it was 3 bedrooms, 2 baths, and had a huge office space in the back, which we have an online sales business. We sell on Amazon and Walmart, Etsy, and used to sell on eBay, but I quit that one just because it wasn't doing that well, and it was more of a pain than anything, so I closed it. But anyway, my point is that we bought this house, and it was like $177,000 when I purchased it. Here's my doctor's office. Anyway, the same home with the same square footage, size and all that good stuff, in Austin would have been at least twice that. I mean, it's insanely expensive there. So, that was a good thing of moving here. Anyway, I'm at the doctor. Time to go in. Here I am, sitting and waiting. Seems like you wait a lot for doctors around here. A little TV at least. Time for the x-ray. I really hate getting blood work done. Okay, well, that's all done. Wasn't too bad. One little poke and she got me. I just hate how so many nurses, you tell them where the good vein is and they just don't want to do it there. I don't understand why. Anyway, this lady got it done. If you ever need to get blood work done, this is the place to come. Ask for Wendy. So I got all of my test results back today from my primary care doctor, and looks like all of my tests came out good. I am actually on my way back from dropping my grandson off at daycare today because his mom is not feeling good. I'm trying to keep my distance from anybody because I can't risk getting sick. I am having surgery in a little over 2 weeks now, almost 3. But I don't want to be around any sick people and risk me getting it, and then God forbid they have to reschedule my surgery. Anyway, all the tests are good. Waiting for the doctor's office to confirm that we are clear for surgery, and I can start making the hotel reservations. So hopefully we'll be feeling better in a few months. So thanks.